Hello and welcome to Business Line Podcasts. My name is TR Vivek. Last week, we published an interesting and important piece on our website on how literacy levels have a profound impact on the success of the government's vaccination drive in a particular area. The piece was written by Soma Wadhwa and Arijit Das, both research fellows at the India Development Foundation, a New Delhi-based policy research organization. The piece itself was based on a much larger study using data for about 740 districts from the CoWIN portal. To discuss the study's findings, what they mean for any intervention aimed at preventing any further waves of COVID, and the importance of robust data and analytics in framing public policy itself, we have with us Soma Wadhwa. Soma is a multiple award-winning former journalist. Nearly a decade ago, she made the switch to academics, and now she specializes in development studies with a focus on qualitative research. Besides being a fellow at IDF, she's also an associate professor at the School of Modern Media at UPES in Dehradun. Hello, Shoma. Welcome to Business Line Podcast. Shoma, tell us about your study and the correlations that you make between literacy and the success of the vaccination campaigns.
Hi, thanks so much for inviting me to your podcast, really. My organization, my research organization, the India Development Foundation, and personally we have an interest in studying the intersections between gender, empowerment, and literacy. And as a part of that, we've evaluated a program called Tara Akshar program. It's an adult literacy program for women. It's been on since about 2013, and we've evaluated it twice, 2016 and now in early 2021. It has sort of functionally literacy. It has imparted to about 2 lakh women over the years. And in its third phase, which has been on since 2017, that's the phase that we were studying in early 2021, which is when COVID was very much firmly ensconced in these areas. So along with all of the other survey questions that we were doing to test literacy and to test numeracy and all the usual indicators to do with functional literacy, we had also put in some questions on financial literacy and 2 or 3 questions on COVID. Did they know the symptoms? Did they know how the like 4 masks were shown and which was the correct way of wearing masks? And we were not surprised, but we were surprised at the difference between women who were literate, neo-literates, who had undergone the program, and the comparison group who had been matched and who were women of similar types in similar villages, but were illiterate. I mean, 80% of the women who were literate said that they knew the symptoms, and 80% of the illiterate group said they didn't.
How big was your sample group?
All total, it was about 1,200 between the two. So we had power tested the numbers for statistical significance, and so it was really. But because it was COVID, some villages were left and all of that. But that we explained in the methodology. So the results are pretty robust, and even the correct way of wearing the masks. I mean, so 85% of the women who are literate, could sort of identify it, and only 32% of the illiterate women would. Now, we realized that there is definitely a correlation here between literacy and health preparedness. There was no doubting that. How we followed up with our, why, how, the causal inferencing, the establishing of, why, the whys, those were done qualitatively, rounds of, sample deputy discussions and all of that. Also, interestingly, Vivek, we had asked a few questions about financial literacy. So we asked all women, do you have, both types of women, do you have bank accounts? And so we realized that the Jan Dhan drive, the financial inclusion drive in the country, had really been effective, because about 85 to 88% of women in both, I mean, almost near similar numbers of women said yes, they had accounts. Most of them had personal bank accounts. And then we asked, do you know the name of your bank? 97% of the literate women did. And 82% of the literate women did, and only about 38% of the illiterate women could, say the name. Similarly, when we asked them about transacting in their banks, huge difference. Similarly, when we asked them questions on financial literacy, simple things like, if you had 100 rupees, you gave your friend lent you lent your friend 100 rupees, she gave you back 102 rupees. What is the rate of interest? 90% of the literate women could answer correctly, and just about 6% answered correctly in the. So we came back knowing, but not knowing that it was such a in such substantial ways empowerment and literacy and financial empowerment and literacy and health. So we came back and we thought, let's look at it, let's check it across the country. Let's sort of test this micro finding across macro. And that's when we actually started doing what you've been so kind to publish both the pieces. We actually then started testing these things for how they were manifesting themselves, or if at all they were manifesting themselves.
Soma, before that, tell us what the survey found in terms of the impact that it has, that literacy has, in terms of the differentials in high literacy areas versus the low literacy areas.
Essentially, what we did is we looked at districts in terms of their literacy rates, and we looked at their vaccination coverage. And it was amazing how districts that were low literacy were so far behind and lagging compared to districts that had high literacy rates. So
lagging in terms of the vaccination rate.
Vaccination coverage, yes. Vaccination coverage, yes. So the example that struck us is, Patnamtitta in Kerala, with 97% literacy rate and 47% literacy rate at this district in Uttar Pradesh called Shravasti. I mean, they began far away from each other, but by end August, I think August end was where we stopped. I think it was 20. I've written it there in the piece. I forget the exact.
Yeah, it is. Yeah, Patnamtitta was at 78% vaccination coverage, yes. And then Shravasti at around 28-29.
And it is quite astonishing, actually. So how do you know, how do we understand whether there is demand for vaccination? By registration, because when you get into COVID, you register yourself, right? So if with literacy, registration is like this. With literacy, coverage is like this. With literacy, women getting vaccinated is like this. So we found huge positive correlation, robust positive correlation between literacy and these three things. And we published an academic paper on it, and then we were looking to update it. We were looking to see, now that there's not so much vaccine shortage and the supply side constraints are like sort of going away, and vaccination is available everywhere. Has it flattened? Now is everybody almost at the same? No, it had gone. It was actually, the gap was widening, and that's what the piece that we wrote in the Hindu Business Line. It was about this, that April, June, and August, the last dates, the gaps had increased from 6 to 15 to 20 percentage points. Between districts that were trending at around 60% literacy rate and 95% literacy rate. So this is huge. Understand what this means. This means that if both types of district had been vaccinated at the same rate, we would have had at least 4 crore more people vaccinated. And this is where actually the issue at stake. But by the time we were updating, with the supply side constraints gone, the registration data had stopped coming in. COVID had stopped giving us the registration data, and also the gender segregated data. So now our updates, we can only look at coverage. We cannot really, and we could say, and we knew that, if nothing was done about this, these districts of high illiteracy were becoming like, potential flare zones for the next surge. Something has to be done to sort of, communication strategies, priority strategies, vaccination coverage strategies. Something has to be done. Targeted efforts have to be, these districts have to be identified. There's a pattern in this. It's not just happening but we don't have data. We do not know. For instance, right now, it is so important to understand vaccines are available everywhere. Why is it why is it so uneven then? Why is it so uneven so staggered across India? There has to be reason. Where are these pockets? Why? What is the reason? We don't know. We don't know the demand. We don't know whether the demand is not there or whether the demand is not being met, because we don't know anything about vaccine hesitancy, because we don't know whether people are not getting vaccinated because vaccination is not reaching there, or people are not asking to be vaccinated. Is it to do with digital penetration? Is it to do with vaccine illiteracy? Is it to do with health? We really don't know. So what we did actually is very basic. We only have vaccine coverage data, and we have literacy data. Also remember, our literacy data is from 2011, the census. So, and while there are ways of projecting for population, there are no ways of projecting for, but there is a pattern. So, I mean, it's robust data, I don't think. And so what we are looking at right now is actually for disaggregated, anonymized, real-time, high-frequency data. Because without this type of data, it is going to be impossible to manage this is an unprecedented situation, COVID. We don't have any role models. Pulling out something from the archives won't help. Pulling out something from a decade-old data won't help. We need to know what's happening now on the ground, and that's where as an organization and as a researcher, I am really
does the government has access to this data and therefore uses it without, say, for instance, our knowing in formulating policy, or is it just not available?
See, these are transactional data. There's no question of them not being available, because every time you take a shot, it's like going to the ATM. It cannot be unavailable, because this is transactional, right? You're putting in your card and money is coming out. So every time it's being recorded. It is surely available. It is a question of whether it is available in the public domain or not. And why is it so important for it to be available in the public domain? Because if you want any kind of meaningful participation by civil society, and I don't just mean academics and researchers, even practitioners, even just development practitioners, NGOs, civil society generally, if you want them to sort of, be invested in how the country is run, or
I'm sure research like the one that you've done would be extremely valuable in policy formulation. So and more minds work on it, the better.
Absolutely. So for instance, let me talk to you about a bit, if I may, about the financial inclusion and the data and financial inclusion. Now, we know that businesses have been devastated in these 2 years. Livelihoods have been sort of stunted, and we know that households and the country has sort of unprecedented economic crisis.
Kind of toll that it has taken on our financial lives.
Yes. They say it's the worst recession that India has faced ever, fourth and the worst. I think Crystal has said that. And so last year, around when the lockdown was on, what the government did is, for 3 months, the government, I think March, April, May, the government put in 500 rupees into each Jan Dhan account. Now, what is Jan Dhan? Jan Dhan is the country's financial inclusion mission. Under it, there are zero-frill bank accounts open for every unbanked household, and with a focus, of course, on poor households, on vulnerable households. So that's what Jan Dhan is. So obviously, if you want to give out money, if the government wants to give out money, it can't go and give money to people, cash to people. So this is the Jan Dhan account then becomes a conduit. That's how you get the money to people. Now, the problem there is that a, how do we know how many people really accessed that money that was given to them? Now, these are, as academic, I'm a little nervous about doing this in the academic world, but I will give you some back of the envelope kind of figures that I've sort of from here and there. So 10,300 crores were deposited in the Jan Dhan accounts between April and May of last year towards this. And on an average, only 3 to 4,000 crore was withdrawn but each month. So of course there can be, if you are true blue academic, you'll say that, but other people might have deposited money. But the thing is this, that there are studies, very secondary and inferencing type of studies by the Yale Institute, and I mean very credible institutes, but there are financial inclusion institute that show that definitely not all poor women got their money. But the thing is that everybody is sort of doing these back of the envelope things, because we really for Jan Dhan don't have any data that is again disaggregated. We don't have data for BPL. We don't know, we know 42 or 43 crore accounts are open. We know how much money is in them. We know roughly urban rural bank accounts, but we do not know how many of them are dormant. We do not know how many of them are active. We do not know how active they are. Are they making digital payments? Are people using overdraft facilities? How many people are really using the debit cards? We have no information on any of this. Now, even BPL, we don't know how many BPL households are really.
From an overdraft facility in a Jan Dhan account, is that possible?
Okay. Yes. So, I mean, so what happens is we actually, in our institute, we have actually made a list of the kinds of the variables that are missing, that are very, very important to know. If any kind of, to say, for example, you were a small financial literacy training institute, and you wanted to go and sort of, tell people how to access this money, in the most difficult times, you wouldn't know where to go. You simply wouldn't know where to go, because you just wouldn't. We don't know. So,
so this is where you mean to say that disaggregated data, or the kind of data that you spoke about, this will then help any agency that wants to increase financial inclusion, or even the government's various arms, for them to do targeted interventions to drive up the usage of the Jan Dhan accounts?
Yes, absolutely. I mean, what I'm saying is that for any small area estimations, for any qualitative investigation into causal inferencing, for any targeted interventions to happen, for any relief aid, anything to do with, actually strategizing and delivery, design, everything, you have to, you cannot go into a dark room and help people. You have to have the lights on. Otherwise, how do you figure out what really to do? So it's very interesting. I was the DMEO, which is the development of monitoring and evaluation office under the NITI Aayog. This was launched in this was sort of constituted, I think, in 2015, September of 2015. This year, we noticed that it has developed something called an inventory of all India surveys. So even if it's not, transactional data, it is some kind of a survey data. So I was just looking at it, and, they have listed, this is very useful. They've listed 81, surveys across India. But from 2021, there are only 20. So only 25% of even surveys. And out of those 20, 12 are really, not government surveys. So there are surveys by people like you, me, KPMG. I mean, the big four. So if I wanted to work now in the pandemic, I don't have any feel of, there are no models there's really nothing to follow. And if I want to know where to do, what to do, I wouldn't know. Similarly, for instance, even the UN Women, and I think everybody knows this, that they're saying that there is a huge rise in domestic violence since COVID, because households are under stress. Monetarily, people have lost jobs. It's not a good time. Children are at school.
What survey is this, Shoma?
No, this is not a survey. This is UN Women, and across there are no surveys, unfortunately. So, what's happening is that there is more and enough information on the fact that there is definitely an increase in sexual, physical, verbal violence within the house. So what do we do about this? We look for data. We look to understand what the dimensions of the problems are, quantitatively, qualitatively. And so what do we have? We have the NCRB, the National Crime Records Bureau, which gives out data on crimes against women. So we look at the 2020 thing, and we see that there is a 8.5% almost decrease in domestic violence, and we wonder why, how is this happening, and we look some more, and then we find that actually I don't think I'll read out all of it to you, but the report itself says that, look boss, there is a decrease in crimes against women, children, senior citizens, thefts, burglaries, robbery, dacoity have declined because there is a pandemic, because there is no movement, because nobody is stepping out of home. That's what they have said. There's a caveat or a qualifier, and it has said that the only things that are increased are all the COVID-related enforcement laws. So okay. So we don't have any data really from. Then what do? We look at NCW, the National Commission for Women. It has put out some kind of press release kind of thing, in which it says that last year in which it says that there's a 2.5% increase in the number of complaints that are coming to us. So we look at what kind of complaints, and what do I find? These are WhatsApp complaints on WhatsApp. Not really. And they are in thousands, so we really don't know how to. And then there are also some politicians who are saying that this is scaremongering, this, that, the other. So this is certainly, anyway, this is not transactional. This is not even recorded data. You might say that somewhere women report more crime, somewhere they don't report, this time they did not report, but this is not even that really. So what do? We go to UN Women, and UN Women says that it's really under on the rise in COVID. Women are really a really bad way, but there are some countries that are really have to do something about gender related SDGs, and we find that gender related SDGs, the indicators for this, India only sort of qualifies, has data on about 43% of the gender related indicators to do with the SDGs. So where are we really at? Where are we really at? Are we really at, because we know that all the thanas now today, there is huge effort to have MISs, Management Information System, so that they can keep. But if you look at what is available publicly from these, you will realize that it's mostly to do with, yes, this was reported. We don't really have a sense of numbers. Qualitative to bahut, I mean, it's far, I mean, it's a big ask right now. But some kind of, collation, a strategy to get all this data together, to get all this data, which is not just recorded data, but data to do with transactions. When things are happening, that is, because today is that day. Today is the day when 3-year-old data is not going to mean at all anything, so yeah.
So I have two related questions, because you discussed in detail about the implications of lack of robust data and current data. As a development researcher, is this a recent phenomenon about government being stingy with data, or have we seen better times in terms of data availability for researchers like you? And the second one is that why do you think the reluctance from the government to share data? Is data indeed the new oil? If data is the new oil, then are we more protective about it because of security implications or whatever the government may think?
And this is a difficult space for me to be in, because I think the first question is really actually I think whether what was. I think now the situation is also very different. I mean, also the technology is very different. We are today talking about we are talking about data to the level. We're talking about big data. We're talking about data to the level of crossings at pictures being taken, and GPS, and locating people, and face recognition, and I could sort of probably do something on Zoom, and then I could probably, so it is recognizing my face and blurring the. So we are talking of another
different kind, different level of data and analytics.
And also, yes, the technology, and also I think the need of the hour. I think the need of the hour is very different, because I mean, what is happening in the world today? I mean, the world stopped for 2 years, right? It just stopped. I have an 83-year-old mother. I mean, she said that she's never seen anything like this, and she doesn't remember her mother seeing anything like this either. So about 100 years, we're seeing something that is, I mean, I don't know whether it will repeat itself. So we need to know on everyday basis. We have no other benchmarks. We have no other anchors. We have nothing else to really, and anecdotes won't do anymore. Usko bura laga, itne log mar gaye. That won't do, because that is really information, and information comes through filters. I think we now need to know what is happening, when it is happening, how it is happening, if possible.
Why the reluctance?
Yes. Now,
do you have any answers within the circles you move around it?
I'm not trying to evade the question. Neither am I trying to trivial. Please don't. I mean, don't think that I'm sort of because I don't think what I'm going to say is trivial. I think there are different kinds of skill sets who should be able to answer different kinds of questions. I think in the sphere of academics, we should be very bothered about identifying where the data gaps are, and what are the implications of that data gap, and filling that data gap. What would it do for me to plug that data gap? How would I be able to strategize, inform policy better if I had that? Why it is happening is, I think, for journalists like you to sort of investigate. And but I suppose I mean, what we want to share with civil society and how much we want to engage civil society is every government's call. And
Soma Wadhwa, thank you very much for joining us.